Blended competencies, clinical reasoning and person-centered care. Our objectives: to describe the concept of caring as part of nursing practice, describe critical thinking and its importance to nursing, define components of critical thinking, list the 5 steps of the nursing process, and describe how the nursing process is the foundation for nursing. First off, we're going to start off with this idea of caring. What is caring? And I think if we were to go around and ask everyone what caring was, we know what it is when we see it. And we know what it is when we experience it. But we need to take it one step further and put some words and language to it so that we can understand what caring is, so that we know we're doing it for sure, and so that we can improve if needed. And that is, we've got to appreciate that caring is thoughtful. What may be caring for me at one moment may not be caring for you at that same moment. It's looking at the individual, and it's looking at timing of a particular action. It's looking at the sound, the amount of things. Sometimes people need a party and sometimes they need one person, and that shows caring. And so it's thoughtful. It's how we can meet the individual need. Another idea about caring is this idea of sick care versus health care. And this really has come to the forefront in the last few years as we've realized that our industry has been more of a more of a sick care industry. We're positioned to take care of sick people. We've got hospitals in place and doctors' offices, and we want people to go there when we're sick, and not realizing that people need to take care of themselves so they stay healthy, so they don't need to come to sick care facilities. You've probably seen the trend towards this idea of healthcare with the Kaiser Permanente commercials, and emphasizing this idea of good nutrition, of exercise, of taking care of ourselves. Because one thing the industry has come to realize is that, and insurance companies for sure, is that it's a lot cheaper to take care of well people than it is to take care of sick people. So if people would be well, they'd be happier, healthier, live longer lives. And in fact, we're going to talk more about the initiative of our government called Healthy People, and right now it's called Healthy People 2020. What are things we can put into place to help our individuals, our communities, our nation be a healthier nation? Another idea related to caring is person-centered care versus I-patient care, the old internet patient. I have watched this evolve more recently as computers have come on the scene in the industry. It's not that computers haven't been around, but with the Affordable Care Act coming into play and mandates from the government that all healthcare providers, if they wanted to get financing, have electronic health records in place. Computers are everywhere. They're in our hospital rooms, they're on the desks, they're in clinics, doctors' offices, they're everywhere. And what's happened, if you've been to the doctor's office recently, is that there wasn't necessarily a good place to put the computer. So the computer lands behind the client, for example, or when people talk to you, they talk while they're staring at the computer, putting in their information. Oh, you feel like, does anyone care about me, the patient, and not the computer? And so caring means it's okay to put your information in the computer, but after you've looked at, made some connection with your patient, because caring is, number 4, interpersonal relationship. It's that engagement, eye contact, getting to know a person. It's a therapeutic relationship. We're not trying to be anybody's BFF, best friend forever, but we're trying to develop a trusting, health-oriented, caring relationship, something that's therapeutic, something that moves people to the best that they can be. And that care is individualized for the person, the family, the community, whatever is needed at the time. It's not formulaic. There may be certain things that are similar, but it needs to be individualized if it's really going to represent caring. And caring is knowledge-based. It means we got to know something. We got to know the right thing. We have to have some right information and evidence to give best care. We have to have knowledge. So caring, thoughtful. It's both sick and health oriented. It's person centered. It's around relationships that develop trusting care, and it's individualized for the client. Person-centered practice has 6 components to it. The first being the idea. It's more than the idea, it's the concept that the person is unique. Every single person is unique. I'm different than you are. You're different than I am. Even within an old family, we're not all the same. Everybody has unique needs based on their experience, their age, their gender, the culture, ethnicity. Put the whole package together and everybody is unique. To give quality person-centered care, the professional nurse relationship is developed. And for the professional nurse to be effective means that they have to recognize their own personal attributes, their strengths and gifts, their knowledge, what they have to contribute, the mastery of the sciences, their skill set, and that they're reflective of their practice. Like, did that work? Or, wow, that went so great with that person. And then the next time that didn't go as well as it did before. What was the difference? How can I improve my care? And so it's thinking back and being reflective in the sense of not only reflecting on that experience, but reflecting and being aware of one's self. What do I bring to this package? What do I bring to this experience? And being honest, straight up front, that we have our own biases and prejudices. And we tend to, I think, first react, maybe I do, in that idea that I'm not prejudiced, I like all people. And it may not be about this idea of ethnic groups or ethnicities. Our prejudices may be such that we have trouble with mean people. Maybe people that are not well kept or they smell bad. People that are poor versus the rich, the popular versus the unpopular. We have prejudices and biases. And how do we own that and give personal quality care to everybody? Everybody deserves good care, not best care for some and adequate care for another. And that means that we've got to recognize that we have biases and prejudices. Assumptions also happen. We assume things, and man, for myself, I assume so fast, I don't even know I've assumed it until I'm down the road and went, oh my goodness, that wasn't even the truth. We have to reflect on those things and realize that they affect the care that we give. That's important to giving quality person-centered care. Be reflective, know yourself, and be honest about it. We've got to have good clinical reasoning to be able to analyze a situation, make right judgments, look at the alternatives, what could happen, what should happen, what might happen, and then choosing best actions and following up on that. Good clinical reasoning. And we can do that best by applying the nursing process, which is how care is organized for an individual person, community, and it's that idea of assessing someone first, then making a right diagnosis, setting up goals and plans for that client, and then implementing care to reach those goals, and then evaluating to see how effective we're being related to that. And note that the RN's actions have to be based on the person's individual response if it's going to be person-centered care. Think about that for a second, and what does that remind you of? Whose definition of the nurse? the American Nursing Association. We give right nursing care by diagnosis and caring for the individual response of the client. That's the only way we can give person-centered care. The person is always first. To give good nursing care, we have to know that nursing is about commitment, and it's commitment to the profession. We are a professional group. We have a professional body of knowledge. We have standards and practices and laws. We have to know our scope of practice. We have to know what's right and best for certain diagnoses, certain people. We have to be committed to growing in those things. I still am learning about all of these organizations. Your book is going to speak a lot to QSIN, which is Quality and Safety in Education for Nursing. People that have researched what will help us be successful and what will help us give best care to people, and then continuing to practice that until we're experts at that. If you look at Patricia Benner's theory about how nurses develop from novice to expert, expertise doesn't come around until like 10 to 15 years of continued practice in that area. So if you wanted to be or were practicing as a labor and delivery nurse, an obstetric nurse, and you worked in that environment for 10, 15 years, you're an expert. And then you decide you want to change and you want to work on a med-surg floor. You need the change. All of a sudden you fall back into this idea, you've got a lot of skill set, but you're advanced beginner competent now. You have to grow into expertise. And that means we have to be committed to this idea of being a lifelong learner. So accept the idea. I know it's your first week of school, maybe second when you're watching this video, but you're going to continue to learn and be committed to your education and development as a nurse for the rest of your life in nursing, for sure. Know that nursing equals caring, and it means that we've got to be about thinking. It's a commitment to all of those things. So if we're going to be a critical thinker, and that's going to be part of this package to give best care and quality care to patients, what is critical thinking? It's critical that we think? Yes. But it's bigger than that. It's how we use that thinking and taking the time to think and grapple with ideas. There's a number of definitions. Let's just review. Berman said that critical thinking is the process of intentional, higher level thinking. Okay, so you do critical thinking on purpose, and you say, I've got to think about this a minute. To define a client's problem, think, what is going on here? Am I seeing everything? To look at the evidence, both in clinical data and research, so that you can care for a client and make choices that are right for that client's care. Alfaro, this one's in your book, says the critical thinking is your ability to focus your thinking to get the results you need in various situations. So the situations may change, but your discipline for thinking has got to be there. Is this going to work here? Or this worked before, I might need to tweak something here. Critical thinking makes the difference between whether you will succeed or fail, whether the treatment will succeed or fail. Paul, this definition was in your book as well, a systematic way to form and shape one's thinking. How are we going to do that? It functions purposefully and exactingly. So you have to think on purpose, and you have to think focused on the issue at hand. It is thought that is disciplined. We have to regularly do it. It's comprehensive, it's thorough, it looks at all the evidence. It's based on intellectual standards. It doesn't just give up and just do something. And as a result, it's well reasoned. You can express your idea and your rationale for doing something. Paul went on to say, and this isn't in your book, and it's one of my favorite definitions of critical thinking. I can remember this, I have it memorized just because it's so catchy. And he says, Critical thinking involves thinking about your thinking while you're thinking in order to make your thinking better, more clear, more accurate. We've got to think about our thinking while we're thinking so that our thinking will be more effective and will come with better outcomes and output for our clients. We have to have good and right thinking, and that's what we're going to be purpose for, well, your whole nursing career, but in particular this semester as we work towards developing our foundation for nursing. Attitudes of effective critical thinkers are numerous. Look through this list and I would just check off the ones that you're pretty good at, the ones that you feel like you do reasonably well, and then circle the ones that you want to give some attention to. Self-awareness is so important. Being honest about what you know and what you don't know. Being patient, curious, reflective, self-corrective, analytical, confident. I'm just skimming through these. None of these are more important than the other. I just did some colors and fonts just so our eye could catch a few different things. But honest, autonomous, and responsible. We have to do it ourselves. No one can make my mind think. It's something that we have to do. So thinking, it's realistic, it's practical, it's proactive, and honestly, it takes courage. So take some time to think, where are you at in this realm of critical thinking? And let me offer for you, just in conclusion here, that the way that nurses critically think is to apply the nursing process. I spoke to it earlier, but here's a slide that gives you the components of the nursing process, and it is this, that we assess the client. And can I say, assessment is so critical, because if you don't get all the data, if you don't assess everything you need to, you won't have all the information you need to make a right and best nursing diagnosis. Assessment is the foundation for everything we do, and it keeps happening throughout this process even. So we make an assessment, and then we give labels to the data and the findings that we have. We're going to work on that in a few weeks. Make a nursing diagnosis, and then we establish a plan as to what, and goals as to what the client needs to accomplish, wants to accomplish. And then we apply and do nursing interventions or actions to help reach that goal, and then evaluate to see if that plan is effective. We're going to apply that idea in class. So memorize those steps so that we can work with that during our class time together. And I'll leave you with that thought and that process as we continue our nursing journey.